Hello viewers, I am Dr. Shrikant, pediatric gastroenterologist. In today's video, we will see what are the causes of blood in stools or blood mixed stools in a small child, in an infant who is less than 1.5 years of age. So this is one of the common condition what I see. There are a list of causes which can present like this. So we'll see one by one. So generally the most common cause is an infection. When there is infection in the large intestine, what we call is colitis, then there will be loose stools and the stools will be mixed with blood. But this starts very suddenly and baby may have fever, weakness, may not feed well and many other things. So it's a short duration of illness. This is one of the important cause. Following this, the other most important, probably the number one cause what I see in my practice is something called allergic colitis. When there is allergy to any of the food item, there can be small ulcers in the large intestine and child can have blood mixed stools. So most common allergen is milk protein allergy. So when the baby is fully breastfed and mother is on dairy based diet, the baby can develop something called cow milk protein allergy. The medical term is called food protein induced allergic proctocolitis. Don't confuse with the terminology. It's basically allergy to the proteins present in this particular food. Here we are talking about the dairy products. Apart from this, there are list of other causes which can present as allergic colitis. So the next one is soya. When the mother is taking soya or baby is given directly soya based products, and wheat, egg, fish and nuts. So these are the 6 items. So I'll repeat it again. So milk is the most common, followed by soy, followed by wheat, nuts, fish and eggs. So these are the things. So this is the second category where there is allergy related colonic inflammation or ulcers in the colon. So the third category is if there is any developmental problems in the colon, if the child is having some abnormalities in the blood vessels, the blood vessels, if they're not properly developed, or if there are some swellings like something called polyps, and if the intestines are not developed properly. So all these things can cause blood in the stools and we need to investigate appropriately to arrive at the diagnosis. This is a third category. Fourth category, sometimes baby can pass very hard stools and hard poops can create small injury in the anal opening. We call them as fissures. So this can also bleed. Very rare in children, but that can happen. So this is the fourth category. And the fifth and the last category is some congenital problems related to clotting mechanisms in the body and also related to platelet count. If the platelet counts are low because of various reasons, if there is any problems in the clotting abnormalities, then one of the manifestation is blood mixed stools. So viewers, I hope you understood what are the reasons for blood in stools. A quick recap of the reasons. The number one cause is infection of the colon, which can present as acute or very short and florid presentation. Second is allergy related colonic inflammation or allergic colitis. The important group here is cow milk protein allergy. The third category is congenital abnormalities, but developmental problems of the intestines where there will be abnormalities in the blood vessels. Fourth category is fissure, and the fifth category is problems in the clotting and bleeding mechanisms. I hope you understood and you enjoyed this video. I hope you found it very useful. If yes, please press the like button and also share with your friends whom you feel it would be necessary. Thank you again and have a good day.